Well, from the beginning, my work is always focused on the most vulnerable. And as a pediatrician, I've always focused on the most vulnerable children, wherever they are in the United States and around the world. It's very difficult to find more vulnerable children than those living in areas of violent conflict and political instability. So my work has taken me to those places. You have to go to these places, talk with the children, talk with their families, talk with community members to really begin to have an understanding of what's going on. It's important, if you're going to address the needs of vulnerable populations in areas of violent conflict, that you go to where the fighting exists. You have to talk with the families, with the humanitarians, with the war fighters, the combatant groups, as well as those who are there to ensure the protection of the non-combatants, particularly of the children. That means getting out in the real world. It's just part of generating the knowledge, the policies, and the advocacy that's required to address the needs of communities in these areas. You can be an effective humanitarian and a pacifist, but you can't be an effective humanitarian and naive. It requires a deep real-world understanding, not only of the pediatric needs of children in conflict, but also what we would call the portfolios of violence, how violence is being used by different groups to achieve their ends, to achieve their goals. Since 2019, I've served as a special expert to the U.S. federal court overseeing the treatment of migrant children in U.S. detention. More recently, my role has expanded and been formalized to be the official juvenile care monitor for ensuring government compliance with the standards of custodial care for children in U.S. custody. And my approach to this issue has been, regardless of how you feel about migrants, regardless of your political ideology about immigration, you could be pro-immigration, anti-immigration, it doesn't matter. What my job is and what my commitment is to ensure that as soon as a child comes into U.S. detention, as soon as a child comes into the custody of the people of the United States, we take care of them. And we take good care of them. And my role has been and will continue to be to do whatever I can as an academic, as a pediatrician, but also as a fierce advocate for children, is to ensure that they get the care that they deserve.